Good afternoon. My name is Jeff Nosnov, and I am the CEO of vSense Medical Devices, and we are the future of vital sign monitoring. Right now, it is impossible to continuously gather health information about a patient without tying them to a bed with tens of thousands of dollars of expensive equipment. Right now, the equipment it gets in the way of the doctor, it is uncomfortable for the patient, and it's also a vector for disease. It's a serious problem. And about 50 years ago, we saw a vision in Star Trek of a world where this kind of health information could be monitored as soon as you hit the bed, with nothing attached to you at all. And at vSense Medical Devices, we have turned that into a reality. In fact, this device has been scanning me since I took the stage. Can we switch to the output, please? Great, so there you have it. So my heart rate is 92, and my respiratory rate is 17. I'm pretty excited to be here. Ooh, so is he. So I got involved with this technology in the last few years. I spent 5 years working at the NASA Jet Propulsion Lab, and in that time, my children were born, and they required continuous monitoring for the first week of their life. Around the same time, I got introduced to a technology that NASA built that uses radar to identify people in a disaster response scenario, such as people under a collapsed building, by looking for human vital signs in a field of view. And I instantly became obsessed with bringing this technology to the marketplace. And I started the company, obtained exclusive rights for the technology, joined IndieBio, and we have been working hard ever since to reduce the size of technology and build a product out of it. So right now, so you can see our original device. It was about the size of a suitcase. This is 4 inches cubed. And in a few months, the device will be the size of an iPhone. So the device measures heart rate variability, and respiratory rate. And it does so continuously, and we're able to mine that data to identify clinical events that are patterns of those vital signs. For example, when you have a sleep apnea event, your breathing stops, your heart rate spikes, and then you take a very deep breath, and we measure those things directly. So sleep apnea, body movement, whether a person has moved, these are just a few examples of the clinical things that we can identify based on the underlying physical data. And we're working with researchers at Stanford and Cedars-Sinai to increase the catalog of clinical events. Fundamentally, the device measures the rise and fall of the chest throughout the breathing cycle. And this gets you the information that you can see on the right. You can see that we measure individual breaths, individual heartbeats, variation in timing of the breaths, and all of this is important clinical information for tracking disease progress and taking care of patients. So speaking of patients, the first market we're approaching is the nursing home market because of the severity of the vital sign monitoring problem in that industry. Nursing home patients suffer because vital sign changes are missed. This happens a lot because nurses are massively overworked and overwhelmed and are sometimes unable to get to each patient on the schedule and manually check their vital signs. It's a huge problem. There are 1.7 million nursing home beds in the United States in almost 16,000 facilities, and even with the $136 billion spent taking care of these people, this information is still missed routinely, and that causes real suffering and illness. But not anymore. Now we monitor and capture that data, enabling intervention before disease strikes or disease progresses. This means that one nurse can now check 20 patients at a time. She can have the information displayed on a screen, or she can save even more time, and that information can be logged directly into the electronic health record. Nurses we've talked to so far think that this will save them hours and hours every day that they can use to actually take care of patients. We have a relatively simple business model, device sales and subscription access to the data. We have a total addressable market of about $600 million in device sales in the United States alone, and that's at a $350 price per device. And at $25 a month per monitored bed, that's $500 million a year of recurring subscription revenue. We're already talking with the largest nursing home chain in the United States, as well as the dominant electronic healthcare record provider, so that we can incorporate our hardware with their software and go into any nursing home on the continent and offer them a compelling solution. That's just nursing homes. From nursing homes, we'll expand to the home senior care market, which is an $80 billion market. And we already have a letter of intent with a concierge physician practice that wants to put our device into hundreds of his patients' homes around the world. From there, we'll make a consumer device so we can bring the benefit of this technology to everyone in your family. There is some competition in the continuous vital sign monitoring space, but it is far inferior to our technology. The wearables category requires people to wear some combination of sensors and wires on their bodies in different places, and they don't send the information to the nurse. The nurse still has to come to get them. So it doesn't really save much time, and it isn't really much more comfortable. There are various pad solutions that go under the mattress and measure certain vital signs, but they actually get in the way. They create more work than they solve because they get in the way of changing the beds and the patient moving and all of that. That and they've been priced very high, so they haven't sold well. Only the vSense Sentinel device that you see there continuously monitors patient vital signs without contact at all. So our technology is as safe as a flashlight. Now, we are regulated by the FDA because we're creating information that doctors will use to make care decisions. But we have as an advisor the former head of the Office of Device Evaluation at the FDA, and so we're confident that we can get through the process. We have an excited and capable team ready to execute this plan. I spent 5 years at the NASA Jet Propulsion Lab managing advanced technology development. My CTO, Hector, spent 10 years there in the same radar systems development division that would later go on to invent the technology. And our president, Ryan, has a decade and a half of business experience founding and selling companies and healthcare asset management experience. We're here today to raise $2 million to get to FDA clearance in 1 year, revenue in 18 months. And thank you for coming. Please come to our table to get your vital signs scanned and experience the future of healthcare. Thank you.